we move forward to the next session. It's again a panel discussion, hospital perspective on technology adoption and challenges. Here too, we have two chairpersons and we have three speakers. Going forward to introducing our chairpersons, we have Dr. Naveen Chitkara, who is the Director and Consultant Neurosurgeon for NHS Hospital, Jalandhar, Punjab. He has been Director of Two Petals Innovations, former Technical Committee member for the NABH, a member of the Quality Council of India, winner of D.L. Shah Award 2014 and 15, and around 48 international and national publications, and 8 innovations accepted in various journals. Our next chairperson for this session is Dr. Colonel M. Dayananda, Director of JSS Hospital, Mysore. He comes with a wide experience in the field of hospital administration and has served in various hospitals of the country. He's an advisory committee member, Bureau of Indian Standards, New Delhi, which is presently developing quality standards for hospitals in India. He has edited a handbook on management of military hospitals. And his last assignment was in the capacity of medical superintendent of KMC Manipal Hospital and the chief operating officer of all teaching hospitals of Manipal University and Sikkim Manipal University. Mr. Sreeni Venugopal, who is the group CIO of KIMS Health. He provides executive leadership and oversight for the entire technology portfolio at KIMS. He drives the KIMS Healthcare IT strategy with special focus on patient-centered technology solutions, telehealth, automation, business analytics, artificial intelligence, and cybersecurity. He has over 27 years of diverse experience in IT strategy, technology solutioning, cybersecurity, international business consulting, and IT service delivery. So we have to move forward to this dynamic session. To hear more, I hand over to the chairpersons. Over to you, sir.
Good afternoon, everyone, and thank you for the opportunity, CAHO. So we will be moving forward to the hospital sector in particular. This is about absorption or the perspective of the hospital regarding the technology. So what we are looking at is that during this COVID pandemic and after that its effects are still felt, that everything has changed and technology has touched lives in different ways. It is not only in hospital, in all aspects of life. You can see people virtually connecting and meeting, and even the students are learning through Zoom mode, as well as we, in fact, in the medical colleges, we are conducting examination through the virtual way. So the hospital is not left unattended. So hospital is also part of the same system. So in the last, though the technology has been there and the hospitals have been there for quite long, the absorption of technology in hospital field was rather slow because of various constraints as well as legal aspects, as well as understanding by the healthcare people about the benefits of IT. So what has happened today is that the COVID has enhanced everything and speeded up everything. So we are forced to adopt technology at a faster pace. First came the telemedicine. It's almost become very routine in our this thing. Government of India came out with very relaxed rules regarding telehealth programs. Now it's become very, very common that we have teleconsultation, telemonitoring is going on. So all this is happening through hospitals also, through clinics and other areas also. So the absorption of technology is rather fast during this time. However, the core activities of the hospital, they still remain the same. It has not really made an impact in terms of what we expect in IT, taking away certain menial jobs and doing something. It is not happening in the hospitals, at least in the larger hospitals. So that is what we need to see, and probably the more light will be thrown by our very eminent speakers. I'm sure they will be able to do a good job of what they are doing in their hospitals or in the hospital fields in particular. Otherwise, in the hospitals, though the technology absorption is slow, it is happening now, and lot of benefit we are getting through companies are coming up, a lot of startups are coming up. Only a few days back, CAHO itself has organized a health innovation this thing, and there are about 15 selected hospitals which presented very unique things that can help the hospital run better, make it more accurate, make it more patient friendly. And that's what we saw only a few days back. So that is again, congratulations to CAHO. So now the hospitals that we are looking at, I'm looking at a larger hospital in particular, though technology is affecting everyone. So in larger hospital, lot more can be done, which we would like to hear from the CIOs. So I will request Mr. Sreeni Venugopal to take on the next presentation, please.
Thank you very much. So I will start a little bit more at the basics, because I think when we say scaling technology adoption, or when we look at technology as such, we think of technology more as clinical, how technology helps the clinical procedures, right? IT and technology is a lot more than that. So I just wanted to draw attention to the fact that when you look at a need for technology in a large hospital, number one, the pandemic has contributed in a big way, and all of you said that, and Kenal, when you started speaking, you said that. So when I look at what are the needs for technology in a hospital, pandemic is now ranking number one, because it has facilitated the adoption of technology much more than what a lot of strategy in the last 5 years could do, and it had to be adopted very fast. Secondly, patient-centric solutions are something that we are quite passionate about. In that sense, traditionally, in a traditional model, the hospital is in the center. Patients come to the hospital and all the services are there. And we are looking at a kind of model where technology will enable us to put the patient in the middle. So there is a patient in the middle and all the services reach the patient. To some extent, you could consider home care within that. To a large extent, you could look at how we treat patient service within a large hospital. Examples like mobile applications for the patients, home care services for the patients fall within that. Technology at a very root level allows business enablement. So when you look at the hospital information system, your PACS systems, or laboratory information system, all of those are business enablement parts of IT that are critically necessary. Technology enables operational efficiency. Again, not very sexy, as Rajiv Sikka said, but this is something very key, because it allows the clinicians, the nurses, the administrative staff to be able to go back and look at information. They can look at patient history. They can see how well they're doing. Where do we need to be more efficient? Where do we need to cut the process time and so on? And that allows us to be much more leaner and more productive as an organization. And technology enables that. Technology enables regulatory compliance, and this is a big thing, especially from a healthcare perspective. The kind of reporting that we need to do for regulatory compliance, and if you are a public limited company, then in terms of your financial reporting to the market, all of this come from technology solutions. They are not regular clinical technology solutions, but there are a lot of technology solutions around this, which a hospital needs to imbibe. There are, of course, new technologies. We just heard in the previous panel about startups and new tech, artificial intelligence-based technologies that help with diagnosis. There are new technologies around wearables that help with home care services and so on. And all of these are new things that are happening in the market. And as a hospital, as a care provider, we need to make sure that we are on top of that. We need to know what's happening in the healthcare industry, both in India and abroad. And how can we integrate that into the services that we are giving our patients today? And lastly, I always look at new patient offerings, because traditionally we have thought of IT as a cost center. I mean, IT automates things, enables things, but IT does not bring in money. But if you look at the current situation, where from the pandemic that we have teleconsultations going on, we have home care services, we have wearables and technology solutions that allow transmission of information from home to the hospitals. Here, IT is enabling a lot of new offerings that we can give back to our patients, to our customers, right? And that actually moves IT from being just a cost center into a center that brings in profit, and makes us participate much wider within the whole hospital system. Keeping in mind the topic for day one, I also looked at some of the challenges when you want to scale technology solutions beyond just our hospital or even within our hospital. So number one, human factors. I mean, if you look at human factors, lack of awareness is clearly a large plays a large part within the healthcare industry. So it's very important that we help our clinicians, our administrative staff, our nurses understand how technology can help them and how these systems will help them do their job better. And that is a big challenge, a big hurdle that we need to overcome within the healthcare industry. Resistance to technology is also a large concern. It is changing. It is reducing in the years that come. And again, there are ways and means by which we make sure that we bring on these stakeholders in the technology journey. Diverse healthcare ecosystems. When you look at standards and so on, you mentioned, Colonel Dayananda, about the telemedicine practice guidelines. Which which gives very good information about what can be prescribed in telemedicine, how telemedicine should be done. But when it comes to the technology solution, it's rather open. So it says that you can use WhatsApp, you can use a telephone, you can use your own technology solution, which is great because then it makes technology accessible to everybody, the healthcare access to everybody, but it also brings with it the challenges of interoperability and so on. Some of the challenges around communication in remote areas still remain, complexity of solutions still remain. And a key area that sometimes is overlooked is information security and data privacy. So today, with telemedicine becoming becoming mainstream, information and patient data that was so far within our internal IT systems are now being exposed to the patients and to the outside world. And it's critical that we make sure that we have the right measures from information security and data privacy, consent management, etc., in place for that. And lastly, cost challenges. So healthcare technology is not cheap. If you want to buy from the biggies, if you want to buy from the international players, they come at a high cost. And that's one of the challenges that we see within technology adoption and scaling. I will give two examples of two solutions that we have within the hospital, and I will not go into too much detail about this. But essentially, what I want to focus on is how these can be scalable. So we have a patient mobile app in the hospital that is used by our patients to access their health information and also to access services in the hospital, like booking appointments and so on. Gives them the ability to access their information anywhere, anytime, etc. It is touch-free, and therefore it has reduced risk of COVID. You do not need to come into the hospital to get your reports. You do not need to come into the hospital to get service. And all of this helps you a lot. But from a scalability standpoint, and a significant reduction of paper consumption and so on. But from a scalability standpoint, having such a platform helps us to add additional features as we go along. We can add home care features into the app. And this creates a two-way dialogue between the patient and the hospital, right? So far, it's a push of information, it's push of services, but not really so much of a pull. This app gives us the ability to listen to our patients. It gives us the ability to understand what they want, and it creates a two-way dialogue with our patients, and that helps us, expand and enhance a lot more. And lastly, I will just talk about the tele-ICU solution that we have in place. Again, it's a great technology solution because we wanted to use the skills of our intensivists in our main center to provide intensivist services to all the other ICUs within our hospital chain. And we put together a solution along with our partner that allows the doctors to have high quality audiovisual examination of the patient, including retinal response, live monitoring of vitals and intelligent alerts and all of that, and AI included. And it comes with all of the bells and whistles. But again, looking at a perspective of how this can be extended, this is a great solution because you can actually extend this to smaller hospitals, primary health centers, government institutions in the state and in the country, because it suddenly gives them access to intensive services, which they could not earlier, right? So that's how technology can be a great enabler in the delivery of healthcare services. And that's how we can actually scale it, where we cooperate within among ourselves as hospitals, as government agencies, and so on, where this technology can play a vital role in how we take that forward to the community and to the other hospitals. So I will stop here and I will stop my presentation. Thank you.
Thank you, Sreeni.
It was a wonderful mix of presentation. Before we take the platform to the discussion level, I would add a few points to that. See, my understanding of using technology in hospital is, whereas technology is something which reduces the human interface, it decreases the human errors, it improves efficiency and the results, and of course, increases the paper or the manual work, and it makes the life very easy for all, the staff members, the doctors, and the patients too. Now, when we are talking about technology in the hospital, I would rather classify the use of technology into different areas of the hospital. The first and the foremost group is where we are using technology for the use by the doctors in their clinical work, or technology helping in their clinical processes and making life easier for the patient, making it convenient, and making it easier for the home care processes and the procedure which are done using the technology. The second subset would be where technology is used in the hospital to improve the processes of the hospital. Third important part of use of technology is where the technology is used for analysis of these processes, and somehow it uses artificial intelligence, or the analysis is then interpreted by the higher up authorities to evaluate all the processes and improve the processes. So whenever we are talking about technology, we have to first see the use of technology in which subset which it is there. The second most important point is very high-tech technology they are using in their hospital. But the project or the process of adoption of technology by the hospitals would not be successful till the time the smaller and the medium scale hospitals and the hospitals in the tier 2, 3 cities, they start using these apps or these technologies for improving their processes, their functions, and for the benefit of the patient. Now, one hiccup which usually comes is that with multiple vendors available, different types of technologies available, if someone goes to a hospital to ask them or request them, asking them to use a particular technology, the person who is important in making the decision might not be aware of all the technological things which are available in the market and what all different platforms are available. Most of the small hospitals are still struggling with using even a telemedicine portals. There are no actual ratings on any of the parameters which are at the moment available in the market, that if we can compare whether this product is an apple, and if apple is to be compared to the apples, then it has to be done like that. If apple should not be compared to the oranges. Then what happens is that I opt for a technology, and within 2-3 months, another vendor comes with new features, and I am again at a loss what to do now, because there is very difficult interchangeability or transportability of the technology between the two vendors. I'm not really sure whether using the technology is going to improve the efficiency in my hospital or not. What is the user friendliness and adaptability of the technology which I am opting for? Every hospital would want to customize the platform which suits it the most. And what would be the actual advantage of the use of technology in the hospital that the customers or the hospitals, they usually do not know when they are exposed to these technology vendors for the first time? They are worried about whether it will be a viable option or not, and what will be the return on investment. So based on these things, what we started with a project in our hospital is that we subdivided a particular platform in terms of usability, adaptability, and all these things into some 32 parameters. And we arbitrarily started to compare the different technology platforms on these. So there were two subsets. First was the technology was used for what purpose in the hospital, and to compare the apples to the apples and oranges to the oranges, how were these two technologies faring against each other? So these were 3 or 4 points which I wanted to suggest before we take it to discussion. You discussed about the needs and the challenges in your slide, which were very elaborate. I think when we talk about scalability, the scalability in perspective of a IT company or a startup would be when it can be used in maybe multiple hospitals. But what I see is that if you talk about technology adoption by the hospitals, the scalability would matter if more number of hospitals in smaller cities and smaller hospitals adopt that technology. So there's a difference. It might be a wonderful thing, could be adopted by very big hospitals, or it could be a simpler solution, but it has to be adopted by much more number of hospitals. So how do you look at this problem to be solved like?
I think that is a very interesting question, in fact. So when you look at technology scaling from that perspective, you're absolutely right. And we need to make sure that the smaller hospitals, the tier 2 cities, the tier 3 cities, they are able to use the technology that we usually promote and show as big hospitals, right? And it is not as complex as we think. There are a number of startups that have solutions that can be used by smaller hospitals. Let me just take a step back, and if you look at the teleconsultation solution itself, right? We have a solution that we use, which is a little more complicated because it needs to connect with our own internal hospital information system, and that integration needs to happen. But if you look at the telemedicine practice guidelines proposed by the government of India, it is quite simple. You can use WhatsApp for your telemedicine. You don't really need to have a complex system for that, as long as you have an offline way of capturing that information and updating it. So many of the solutions that we think are complex are actually not complex. It's just the fact that when we want complex integration, then it becomes complex, number one. In terms of adoption of technology by smaller hospitals, from my perspective and the way we look at it in KIMS is, what sort of solutions can we provide that can be used by smaller hospitals in our region? So if we look at tele-ICU, for example, it is a solution that we have built, but that can be quite easily deployed in any of the smaller hospitals within the state or within the country, which means that when we provide the service as through the solution where the smaller hospitals can access the expert care that we have within our system or within our hospital. That is one way that we look at it. When we look at solutioning as in technology adoption, then we are very open to help smaller hospitals through their journey of the technology solutions that they build using the expertise that we have to offer, so that the solutions don't have to be complex. It does not have to be too wide and deep, but it can be what will help them address their immediate need of patient care, as well as making sure that they have good traceability and monitoring of their services that they provide back to the patient. So it all depends on what level of complexity that you need to go to, what level of care that you're providing, and so on. So it's not an easy answer, but two ways. One, through solutions that we create and we hand over to smaller hospitals so that they can access our healthcare. And number two, by helping smaller hospitals through their technology journey.
Excellent. I would like to say, just add on to this, that it's said that necessity is mother of invention. So maybe as Girdhar sir and Dr. Vijay Agarwal said in the beginning, that it is a very short journey for CAHO of last 8 years. Maybe CAHO can be used as a platform where we first teach the hospitals why they should be using technology. We should not introduce technology to them. So we give them, say maybe we can start a master series classes on CAHO or something like that, where we just make them aware of that you are doing all this work manually. And if you shift to technology, these are the advantages which are available to the hospital by using the technology. And then once the hospital becomes receptive to listen to the adoption of technology, then we introduce technology to.
Thank you so much, Dr. Chitkara, and all the Colonel Dayananda, as well as all the wonderful speakers.